Good morning, students. Topic for today is temporomandibular joint. So, temporomandibular joint is a condylar variety of synovial joint. So, what is the meaning of condylar joint? A joint in which one articular surface is ovoid in shape. So, you can see here this is the temporomandibular joint, and one articular surface, that is the head of the mandible, is ovoid in shape, and the other articular surface, that is the mandibular fossa, is elliptical cavity. So one surface is ovoid and the other surface that receives this ovoid part is elliptical in shape. So this is what a condylar joint is, and it is of course a type of synovial joint. So you can see here in the figure also, this is the head of the mandible, the ovoid articular surface, and it fits into this fossa, this elliptical cavity above. Articular surfaces of the temporomandibular joint. So the upper articular surface and the lower articular surface. Upper articular surface is formed by the articular tubercle and mandibular fossa, especially the anterior part of the mandibular fossa. The posterior part of the temporomandibular joint is completed by the tympanic plate, and the lower articular surface is formed by the mandible, that is the head of the mandible. So this image here, it is showing the various parts of the upper articular surface of the temporomandibular joint. That is, this is the zygomatic process, and there is a tubercle which is known as articular tubercle because it is involved in the formation of a joint. That is why it is known as articular tubercle. This fossa, because it lodges the head of the mandible, so it is known as mandibular fossa. And in this green you can see this is the tympanic plate which forms the posterior part of the temporomandibular joint. So tympanic plate temporomandibular joint के formation में ओनली उसको कंप्लीशन करती है, बट ये किसी दूसरे बोन के साथ में आर्टिकुलेट नहीं हो रही है. सो इट इज़ द नॉन आर्टिकुलर पोर्शन. सो दिस इज द अपर आर्टिकुलर सरफेस. द लोअर आर्टिकुलर सरफेस इज फॉर्म्ड बाय द हेड ऑफ द मैंडिबल. दिस इज मैंडिबल बोन. दिस इज द रेमस ऑफ द मैंडिबल. इट हैज़ टू प्रोसेसेस. सो दिस इज द हेड, दिस इज द नेक, and this head is the lower articular surface of temporomandibular joint. Ligaments of the temporomandibular joint. There's a fibrous capsule, lateral temporomandibular ligament, sphenomandibular, stylomandibular, and pterygomandibular ligament. Fibrous capsule, it gives lining to the joint, and it is attached to various parts of the articular surfaces of the joints. Like above, it is attached to the articular tubercle. In front, it is attached to the circumference of the mandibular fossa. Behind, it is attached to the squamotympanic fissure. And below, to the neck of the mandible. And this capsule is loose above the intra-articular disc and tight below the disc. So in this image here, this is the articular disc you can see. And the area above the articular disc is upper compartment, area below is the lower compartment. And above this disc, the fibrous capsule is loosely attached, but below it is tightly attached. Why it is tightly attached below? Because in the lower compartment, that is below the articular disc, both gliding and rotatory movements of the joint take place, and above only the gliding movements are taking place. That is, only the bones are sliding on the disc. But in the lower compartment, there is even rotation taking place. So the fibrous capsule is tightly attached below this disc. It is a synovial joint, so synovial membrane lines the fibrous capsule as well as the neck of the mandible. With this figure, We will try to understand the attachments of the fibrous capsule. We'll try to identify the parts we have already seen previously. This is the articular tubercle. This is the mandibular fossa. This is the tympanic plate, the posterior non-articular part of the TM joint. This is the head of the mandible. This is the neck of the mandible. In between is the articular disc. This green dotted is the fibrous capsule. So above the capsule is attached to the articular tubercle. Below it is attached to the neck of the mandible. Behind, on the posterior side, it is attached to the squamotympanic fissure. This is the squamotympanic fissure. It is known as squamotympanic because it exists between the squamous part of the temporal bone and the tympanic plate. And in front, it would be attached to the circumference of this mandibular fossa. This would be the squamotympanic fissure. Lateral temporomandibular ligament strengthens the lateral part of the fibrous capsule. So basically इस ligament का role होता है कि जो fibrous capsule है जो already strength दे रहा है ligament joint को stability दे रहा है उसको further strengthen and reinforce करने का काम है lateral ligament का. Its fibers run downwards and backwards. It is attached to the articular tubercle and below to the posterior lateral aspect of the neck of mandible. This is the lateral ligament. It is attached to the articular tubercle above and below it is attached to the posterior portion of the neck of the mandible, and it gives, and the fibers also you can see running downwards and backwards, going back, and it gives strength to the capsule. Again the figure showing you lateral ligament coming from the articular tubercle to the neck of the mandible. Sphenomandibular. So as the name suggests, it is superiorly attached to the spine of the sphenoid bone and below it is attached to the mandible. That is there is a mandibular foramen and it contains a lingula. Lingula is basically lip. Lingula is used for lip. So foramen bears a lip and that is known as lingula. So it is an accessory ligament, supporting ligament, lies on a deep plane away from the fibrous capsule. In this figure you can see this is the spine of the sphenoid bone and this is the mandibular foramen. On the medial surface, on the inner surface of the ramus of mandible, there is this mandibular foramen and the upper portion is like a lip. It is like a linear elevation, so that is referred to as lingula and this ligament is attached on that. That is why it is known as sphenomandibular ligament. This is the sphenoid bone और इसके दोनों साइड पे आपको spines दिख रहे हैं. These are the sphenoidal spine and यहाँ से superiorly the sphenomandibular ligament is attached. Stylomandibular ligament is also an accessory ligament. It is the thickened part of the deep cervical fascia which separates the parotid and submandibular salivary glands. जब हमने parotid gland, submandibular salivary gland के बारे में discuss किया था, we have already seen this ligament. It extends from the styloid process to the ramus of the mandible. So this is the stylomandibular ligament. It is extending from the lateral surface of the styloid process to the angle of and the ramus of the mandible, the posterior border. This is the posterior border, this is the anterior border. So it extends to the posterior border and the angle. Pterygomandibular. This ligament, as the name suggests, on one side it is attached to the medial pterygoid plate. There is a medial pterygoid plate and on which there is pterygoid humulus. So it is attached to that part above and below it is attached to the inner aspect of mandible just behind the third molar tooth. So in this basal view of the skull bone, These are the medial pterygoid plates, and this portion is referred to as the pterygoid humulus on both sides. So the pterygomandibular ligament extends above from this and then gets inserted somewhere here into the inner aspect of mandible just behind the third molar. So somewhere here it gets inserted. This is the pterygomandibular ligament. It is coming from the medial pterygoid, the pterygoid humulus, and down on the inner side of the mandible it is getting inserted. Articular disc of the temporomandibular joint. So there is an oval fibrous plate. It divides the joint into two compartments, upper and lower. In the upper compartment only gliding movements, मतलब जो bone है वो सिर्फ slide करती है, it just glides. But lower compartment में both the rotatory and the gliding movements are taking place. So here you can see this is the articular disc. The part above this is the upper compartment, and below it you have the lower compartment. So you can see here the superior surface. The superior surface of the articular disc is concavo-convex. It is both concave and convex, and the inferior surface is concave. And the fibrous capsule is attached to the periphery of this articular disc. Articular disc has various parts also. All these parts we'll try to understand them with the figure. So these are the parts. This is the articular disc basically. So it is concavo-convex, superior surface, and the inferior surface is concave. So it has got an anterior extension. This is the anterior extension of the articular disc. This is the anterior thick band. This is the posterior thick band. Anterior band, posterior band. तो दोनों के बीच में जो band होगा, that would be the intermediate band. So this is the intermediate band. And this is the bilaminar region which contains the venous plexus. So these are the various parts of the articular disc of the temporomandibular joint. Now, articular disc is functionally, it is very, very important. What are the functions? It prevents friction between the articulating surfaces. It is a cushion. It helps in absorbing shock. Stabilizes the condyle by filling up the space between articulating surfaces. So stability as well as safety दोनों देती है articular disc to the temporomandibular joint. Weight distribution across the TM joint is possible because it increases the area of contact. So as you can see here, basically this is head of mandible and this is that fossa. But इस point पे ही जो weight है वो नहीं रहता. It is distributed to a larger area because of this articular disc. This disc also contains proprioceptive fibers which help in the regulation of movements that take place at this joint. So this disc is supplied by two very important branches of the external carotid artery. These are the terminal branches of the external carotid artery, that is the superficial temporal and the maxillary arteries. Veins, they follow the arteries. So this is the superficial temporal and the maxillary branches of the external carotid artery that supply the articular disc of the temporomandibular joint. Also, the auriculotemporal nerve, the mesenteric nerve are the nerve supply to the joint. Movements possible at the temporomandibular joint. The movements and the muscles, they are very important. The movements possible are depression. So this is depression of the mandible. When we open the mouth cavity, we draw the mandible downwards. This is depression. The muscle that plays a very important role, the main muscle that depresses the mandible is the lateral pterygoid muscle. It is an important muscle. It comes under the category of muscles of mastication that we would be discussing in detail later. Other muscles are digastric, geniohyoid and mylohyoid. We have already covered these muscles in the suprahyoid group of muscles. They also help in depressing the mandible when the mouth is open wide. And also gravity also plays a role. Elevation, when we close the mouth, that is elevation of the mandible. The muscles are masseter muscle, temporalis muscle, that is the anterior vertical middle oblique fibers. Medial pterygoid muscle, both the sides of the medial pterygoid muscle. So in depression, only one muscle of mastication is participating, that is lateral pterygoid. And in elevation, you have three muscles of mastication, that is masseter, temporalis and medial pterygoid participating. This movement takes place against the gravity. It is an anti-gravity movement. Protrusion is drawing the mandible forwards. It is also known as protraction of the chin, and both the pterygoids and masseter, especially the superficial oblique fibers of the masseter and the lateral and medial pterygoid, play a role in the protrusion of the mandible. Retraction is drawing the mandible backwards. It is known as retrusion or retraction. Superficial oblique fibers कर रहे हैं protrusion and deep vertical fibers of the masseter are involved in retrusion, as well as the posterior horizontal fibers of the temporalis. Chewing movement, very, very important movement in which the joint basically moves from side to side. So it is also known as lateral movement or side to side movement. So left side पे move करने के लिए you have the muscles of right side, that is the lateral pterygoid and medial pterygoid of right side will push the chin to the left side. So we are referring to these movements. Right side, left side. So to take the chin to the left side, the right pterygoid muscles, that is the lateral and medial pterygoid of the right side, would draw the chin or would move the chin to the left side. And chewing of the food is possible because of temporalis and masseter. So in this movement, all the four muscles of mastication are playing role. The pterygoid muscles are moving the chin, और pterygoid muscle जिस side की होगी उससे opposite side में chin को move करेगी. So if the muscles are of right side, they'll move the chin to left side. And temporalis and masseter would chew the food, और वो same side की होगी. अगर left side है तो left temporalis and left masseter would chew the food. And vice versa. If it is right side, then the left lateral pterygoid and left medial pterygoid would participate. Clinical condition associated with the temporomandibular joint is dislocation of the joint, is possible if there is excessive opening of the mouth, then the head of the mandible of one side or both the sides can slip anteriorly into the infratemporal fossa. Below the temporal bone, there is a space in relation with the base of the skull. That is known as infratemporal fossa. And if there is dislocation of mandible, there is inability to close the mouth. There could also be an injury or derangement in the articular disc, and that can give rise to a clicking sound and pain during the movements of the jaw. So that's it. That's all about the temporomandibular joint. Thank you so much.